Hello, everybody. My name is Rick Lehman from St. Louis, Missouri. I'm an orthopedic surgeon, specializing primarily in sports medicine. And today we have a panel. We're going to talk about post-COVID care and treatment, physical therapy, inactivity training, and specifically how you come back after having COVID and what you do while you're sheltering in place. We have an excellent panel today, including Jessica Byerly, Bryce Hollinger, Mr. Modi, Jackie, Ashley, and Robin, if she can hear us. And we're going to go through some very specific questions with some very specific data. There's a tremendous amount of data out there on COVID. Unfortunately, no one has really talked about what you do after you have COVID, and no one's really talked about therapy and how you come back from COVID and how you avoid the inactivity of sheltering in place. So we're going to jump right in. And first of all, I'd like to ask Jessica, tell us who's most at risk and who needs post-acute therapy, i.e. you've already had COVID, you're home, you're better, maybe you're weak. Who's most at risk and who needs therapy after resolving the acute problems with COVID?
Thank you, Dr. Lehman. The patients that are most at risk are the patients that post-acute COVID that are probably going to need rehab or being seen in an outpatient setting are going to be the patients that are hospitalized, patients that might have been on a vent in the hospital, patients over the age of 65, and patients that have comorbidities or chronic diseases prior to having COVID that put them more at susceptible risk for getting COVID. So these patients are going to have more impairments post-COVID that therapy can help treat.
Thank you. Mr. Modi, what are the most common impairments? What do you think you guys are going to see the most as we come out of this COVID acute process? People are at home, people are going to physical therapy. What do you think the most common impairments from a physical therapy standpoint we're going to be treating?
So it's a great question. Thank you. You know, we see deconditioning is number one. You know, most of the patients who are quarantined, we see that they have lost significant muscle strength. Pulmonary, their pulmonary functions are down. Their ability to walk and balance has been impaired because of the quarantine, COVID-19, and they have fallen. So their risk of fall has significantly increased because of this new COVID-19 and their ripple side effects, the domino effect. So we have I have not seen any COVID-19 patients, but I have seen patients coming back from self-exile, I call it, COVID-19. And when they come back, one of the patients said, I gained 20 pounds and I have lost muscle strength and I have fallen a couple of times. So that's what I'm seeing right now.
Thank you. So Mr. Modi, in terms of weakness, how weak do these patients get? I mean, you see significant muscle strength loss. Can they walk? Kind of give us an idea of how sick they really are.
So giving you an example of another patient who had failed back surgery. He lost about at least 1 grade of strength. So that's significant to me. You know, when I reassessed him, when they come back, we definitely do a reassessment on them. And patient has lost at least 1 grade of quadriceps, postural back, postural muscles, quadriceps, and this thing I have seen. So when your ankle dorsiflexors are affected, it definitely affects your ability to balance because they are your first responders when you lose your balance. So patient went back from not using anything to went back to using walker. So I'm looking at maybe 4 more weeks of therapy to get patient back to where patient was. So I hope that answers your question.
Thank you. Ash, so you're home, you got discharged from the hospital, you were in the hospital 5 days, you weren't chronic, you weren't on a vent. When do you start physical therapy? And the second part of that question is, you were on a vent, you're in the hospital a month, when do you start physical therapy? What's the timing? When do people need to think about getting going? When do they need to think about getting into therapy?
Immediately, they need to get into therapy. As soon as the physician allows them to start up with therapy, they need to get in. It's most important that we see them immediately. So with the patients that have had COVID-19, they have to have 2 negative tests or be symptom-free for several weeks before we can see them in the clinic. But it's important that we have the early intervention in order to get them back to their prior level.
Thank you. So the patient is ready to go to therapy. They've been sick. They've scheduled PT. They're coming in. What type of monitoring will they need to get discharged from the hospital? And what type of monitoring, Ms. Jessica, do they need in the clinic? What do we need to do to monitor these patients in the clinic post-COVID?
So it's really important for post-COVID patients to continue to monitor their oxygen levels during activity. So in the clinic with activity, we'll make sure that they have O2 saturation rates. We'll also monitor heart rate, respiration rate, blood pressure during activity. Post-COVID patients should really be monitoring their oxygen levels at home during activity too. So it's important that they have like a pulse ox at home as they're recovering and doing rehab programs too.
That's excellent. I think that's really important because, you know, they follow their pulse ox. You don't want them desatted, and we don't really want them desatted in the clinic. So I think that's important. Robin, if you can hear us, what does a program look like? What's this post-op program or this post-surgical, if they have surgery, post-hospitalization, and if they're just in the hospital, or post-COVID program look like in terms of just a general, how often they go to therapy? What can the patient expect when they go to therapy? Bryce, you want to take that one?
Sure. So when these patients are coming into therapy, they're going to expect a pretty diverse range of things that we're doing with them, right? So we need to be tackling their aerobic capacity because they've lost that almost completely when they're either hospitalized or at home for a prolonged period of time with inactivity. And that's something that's going to come back pretty slowly. So we don't want to rush patients into, you know, getting 30 minutes on the treadmill or 30 minutes on the bike right away. You know, we really have to be working that in slow spurts. And then also monitoring their rate of perceived exertion. So making sure that the activity is a tolerable amount for where they are at in their recovery. So for example, if the patient is on the exercise bike for 5 minutes and their rate of perceived exertion is a very high intensity or extremely high, we know that that's probably their max limit, and we maybe are even pushing it a little bit too far. So being in a therapy clinic to have a therapist monitor that is really vital. And I would never recommend a patient try and monitor themselves at home from, you know, doing all of that independently. They really need a therapist to guide them to the amount of aerobic activity they should be doing on a day-to-day basis, as well as the frequency, so how often to do it, and the duration, how long to do that. The other types of things that we would be doing in a therapy program would include some strengthening. So I think Modi talked about earlier, you know, these patients are losing a lot of strength and they're becoming very weak from the amount of inactivity. This is muscle weakness, all right? It's involving, you know, the large muscle groups where, you know, we would be working on a lot of different exercises to strengthen them, but we're also looking at their diaphragm and strengthening their breathing capacity because they've lost that substantially as well. And, you know, these are just some of the basics of a program, and tailoring it to exactly what that patient has lost. The patient is also probably has some functional limitations that they're coming out with, and those would be addressed as well. So, you know, it could be simple things like not being able to put a cup into the cabinet, or, you know, just walking around the house or going up the stairs. Those are things that are incorporated into those programs, and we want to make sure that when a patient leaves and is discharged from that therapy program, that they are feeling confident in being able to achieve their day-to-day activities.
Great, thank you. Mr. Modi, so what are you worried about long-term? Obviously, there's a couple things that we're seeing. We're seeing pulmonary issues, we're seeing muscle wasting, we're seeing actually some strokes, we're seeing some cardiovascular issues. But what are the long-term complications? And in therapy, how are we going to prevent, or how are we going to treat those long-term complications, and how are we going to prevent the patient from having some of those long-term complications?
Okay, so there are a range of long-term complications that patient will come with, or patient will face if you don't address it early on. Like you stated, that the biggest things are aerobic capacity or the lung capacity. That translates into the overall endurance, you know. So in physical therapy, I believe the first thing you should address is endurance, the cardiovascular endurance, pulmonary endurance. At the same time, the muscle strength itself should be addressed as well. Because of the inactivity at times, we may see some of the muscle atrophy because of that, and that can lead to reduced functional activities. And what will happen going forward, one of the long-term complications I see in the population I treat is having a high fall risk and fractures. So when your cardiovascular endurance, pulmonary endurance reduces, your overall activity tolerance reduces. And what you would do is you probably would not use your muscles. And what I can foresee is having hospitalization from reduced muscle strength, reduced pulmonary endurance. Patient will be more exposed to having a high fall risk. So this is what I'll be more concerned as a long-term side effect, having a rehospitalization of these patients.
Awesome.
So
Thank
they would
you.
come out. Yeah. Mm-hmm.
Go ahead.
Yes, that's it. Thanks.
So Ash, patient post-COVID, a little bit sick. Tell us what the concerns are going to be in the clinic. You know, why should they be comfortable in the clinic? Why should they not be nervous about coming to the clinic? And what are you going to do if they're too weak to be able to get to the clinic? So they can't really walk, they're not really independent, they're just getting their strength back. Number one, how are we going to get them to the clinic, or what should we do to treat them prior to they get to the clinic? And number two, what do we have to do to make them feel comfortable in the clinic, other patients, other therapists, et cetera, in this post-COVID environment?
Okay, so to start with in the clinic, as far as them coming into the clinic and feeling safe, CORA is every day we have a very structured safety precautions that we're taking in regards to anything from keeping the patients 6 feet apart to wiping down every piece of equipment in between patients, to wearing masks when appropriate. And then the patient is also still filling out the questionnaire when they come into therapy to make sure that they don't have a fever, to make sure they haven't been exposed to anyone with symptoms. So the patients are feeling very, very safe. They express it every day to me how safe they feel coming in. But there are those patients that are still not going to feel safe. They may, so we have other options. So say they can't get to the clinic because of a transportation issue, they're too weak to drive themselves. We have the option of telehealth. We're doing so many telehealth visits, and we have different options of platforms, whatever works for that patient. So we have the telehealth option, but also we're seeing patients in the home through home visits with our Medicare population. So there's whatever option the patient feels comfortable with. If they're too weak to get to the clinic at first, or just a safety concern, we have the option of the telehealth. or the home visits. And then when they feel comfortable or strong enough to get into the clinic, then we can get them to the clinic. I hope that
Awesome.
answers your questions.
No, that was good. So Robin, do you have anything to add? Do you have in terms of anything we've missed, thoughts that you have in terms of the acute patient care, and what we can expect post-COVID in terms of acute therapy?
Okay, well, I missed some of the beginning, so I jumped on when y'all saw me 2 faces at a time. That's when I actually got on here or could hear everything. So I apologize. But as far as the hospitals go, they are actually seeing an increase of patients needing this post-COVID treatment. So what I've been doing is I've been going out, actually sending information out to all the hospitals, and I've been getting a good reaction from them as far as having something somewhere to send once they are released. I know that one hospital specifically recently has been talking about the home PT2, and I don't know if we're doing that across the board, but when we are doing that for Medicare patients, that's actually a big thing for them too. As far as clinical portion, that is definitely not me. But as far as hospitals, I deal strictly with the case managers. So the case managers are the ones coming to me saying that they need to find out where we're treating. They're loving that we're doing telehealth. That has actually been a really huge thing for them as well. So
That's excellent. All right, so first of all, thank you, everybody. That was very concise, and I really feel like we're just coming into our own in terms of treating these acute patients. They're getting home, they're getting well, and now all of a sudden they have to come back, get strength, get their jobs back, etc. So this was a good synopsis of treating acute patients who are trying to recover from the virus and who are going to re-enter a normal lifestyle. So thank everybody.